The Trump administration's decision to pause foreign aid has sent shockwaves through global health initiatives, leaving millions without access to essential medical care. This move, driven by a reassessment of U.S. foreign spending, has forced health programs worldwide to halt operations, with devastating consequences for vulnerable populations. The United States has long been one of the largest contributors to global health programs, funding efforts to combat HIV/AIDS, malaria, tuberculosis, maternal and child health issues, and more. Organizations like the Global Fund, the World Health Organization, WHO, and USAID depend on U.S. contributions to maintain life-saving interventions. However, with aid frozen, many of these programs are now struggling to survive. Countries in Africa, Latin America, and Southeast Asia, which rely heavily on U.S. funding, are experiencing immediate repercussions. Clinics providing antiretroviral drugs to HIV-positive patients have reported shortages, forcing some to ration medications. Vaccination programs aimed at preventing measles and polio have stalled, raising fears of outbreaks that could have been prevented. Maternal health services, including prenatal care and safe childbirth initiatives, are also being affected, increasing the risk of complications and mortality among pregnant women. The Trump administration's foreign aid pause stems from a broader strategy to review U.S. spending abroad. Citing concerns over waste and inefficiency, the administration has argued that American taxpayers should not be footing the bill for global health efforts without a clear return on investment. Additionally, some of these cuts align with ideological positions, such as restrictions on funding for organizations that provide abortion services. Critics argue that these justifications overlook the strategic benefits of global health investments. By funding health programs in developing nations, the U.S. helps prevent the spread of infectious diseases, reduces instability caused by health crises, and strengthens diplomatic ties. Moreover, many of these programs were previously supported on a bipartisan basis, with both Republican and Democratic administrations recognizing their value. Beyond the political and economic debate, the most significant impact is on the lives of millions who rely on these programs for survival. Health workers on the ground describe heartbreaking scenes: children unable to receive routine immunizations, HIV patients struggling without their medication, and overwhelmed hospitals unable to cope with rising demands. Non-governmental organizations, NGOs, and other donor countries are scrambling to fill the gap left by the U.S., but the scale of the funding loss is difficult to offset. Many fear that if the pause extends for too long, years of progress in global health could be undone, leading to a resurgence of diseases that had been on the decline. As the international community reacts to the aid suspension, pressure is mounting on the U.S. government to reconsider its stance. Advocacy groups and foreign leaders are calling for a reinstatement of funds to prevent further harm to global health efforts. Whether the administration will reverse course remains uncertain, but for now, millions remain at risk due to a policy decision with far-reaching consequences.